moving on, Gerhard Sundborn, who's Professor of Public Health at Auckland University. Gerhard's going to talk about a paper that he was an author on that was submitted to New Zealand Medical Journal just before Christmas, I think, and triggered some interesting debate. Gerhard, over to you. You with us?
Yeah. Can you hear me all right?
Yeah, we can. Go for it.
Good one. So if I just share screen, I click on that to...
Yep.
Is that all right there?
Yeah, we're good.
Okay.
Right,
thanks, Mark. So for my presentation, I'm just going to talk basically about this paper we had published on the 22nd of December and kind of running through it. First, I want to give a little bit of a background information to the paper and the whole journey. Then I'll go through the paper, and then after that, kind of discuss where I think the government is when it comes to the elimination strategy and the use of lockdowns from here on in. So this is the paper, Chasing Elimination Through Lockdowns, is Stamping Out Livelihoods and Lives, and it was published on the 22nd December in the Journal of Primary Health Care here in New Zealand. And the background is my colleague who you've just heard from, Dr. Simon Thornley, published this piece on the Stuff News website, talking about, do the consequences of this lockdown really match the threat? And this was published about 5 or 6 days into our New Zealand lockdown. And one of the kind of take-home lines that resonates with me is that do we want to squash a flea with a sledgehammer and bring the house down? And so I think this paper kind of addresses that as to why we think the elimination strategy was not the right thing, and that lockdowns take a very very hard measure to control this virus, which I think is an overreaction. And from that, then our COVID Plan B group was formed, and I think over that time we've had a lot of opinions and perspectives on the virus that have more often than not been overlooked by the media and by the government here in New Zealand, and we've got a different view to what's been listened to, and so that view has been it's been difficult to be heard at times. So we thought that by putting these our views in a letter and submitting it to a medical journal here in New Zealand, it would be a way that we could maybe share those views more widely. It's interesting that some of our views have been published in the British Medical Journal and major news outlets around the world, but here in New Zealand, we've struggled a bit to voice or to have the other side of the argument portrayed to the public. So by getting this letter published, it was great. Unfortunately, it took about 3 or 4 months to get it through, and we had to go to a couple of journals in order to get it published eventually. And the great thing that I think the editor at the Journal of Primary Health Care done was they took the letter and presented it to the Ministry of Health and the government and asked for a response to the letter. And so you can see that on the screen, the top left corner there, in the same issue when our paper was published, a response was published from the Ministry of Health, and it was their Chief Science Advisor, Dr. Ian Town, who published that. Within our own media here in New Zealand, the New Zealand Herald kind of covered it, not the most positive review of the paper and the situation, but also too it prompted the invitation from a media outlet to arrange a debate with Dr. Thornley and also Professor Michael Baker around the whole elimination strategy and the use of lockdowns. So it was quite useful in that sense. So now in the paper, so we've said, and I think already this morning we've kind of covered a lot of it as to why the elimination goal is unrealistic. And in the paper we say how New Zealand is one of the few countries chasing elimination in the world, and that although there were claims here in New Zealand that we achieved elimination a couple of times, the criteria for elimination as defined by WHO was never met, and that means having no community cases for 36 months and having extensive testing and support of genomic data that reaffirms that. And also too, like we know that even with effective vaccines, elimination is unlikely, as we have seen for influenza. We have a number of vaccines that come around every year, and it hasn't been and will never be eliminated. So we see that COVID-19 will be endemic around the world. It already is, and to think that New Zealand can maintain some kind of elimination status, I think is unrealistic. So we talked a lot about the harms of lockdowns, and here in New Zealand, as other places, there's a lot of different examples of the harm that lockdowns have caused. And so, some of these, if we just go along the top, about mothers who gave birth during lockdown, a lot of them had to leave the hospital early, and during their stays, they had no one to care for them. A lot of them were readmitted later on, about 47% of them. A recent study has shown for a number of reasons, including like maybe leaving hospital after cesarean too early. Here in New Zealand, there was a spike in acute rheumatic fever cases during lockdown because people were stuck in their homes and in close proximity to each other. There was a spike in domestic violence on the 3 days following our first lockdown. There was a 20% increase in reports of domestic violence to police. We know that there's mental health crisis, and COVID and the lockdown has stretched our system, which is already stretched with regards to that. There was a doubling or tripling of need for food parcels from food banks around the country, and we know that we've had a significant increase in those unemployed, but also to a number of small to medium businesses have gone to the wall and been lost. So those are some of the harms. But in our paper, what we wanted to do was kind of look at how can we kind of look at the sum total of those harms. And so what we looked at was life years lost. And in our first symposium, Professor Bhattacharya showed us a very insightful presentation how due to the economic retraction of New Zealand's economy, that it equated to losing about approximately 1 life year lost in life expectancy. And so the calculation we done was that across New Zealand, it equaled a loss of 4.8 million life years lost. And we modelled what was lost of Sweden. And if we followed Sweden's approach, it had been more freer, we would have lost 14,500 life years lost, which meant that the route that we took by having a very stringent and severe lockdown, we lost 330 times more life years than what would have occurred if we took a more open approach. And so also to have another look at the, I suppose the calculations behind that, Dr. John Gibson from University of Waikato also does this type of modelling. And his modelling wasn't as drastic. His found that if we had taken a more open approach, similar to what Sweden had taken, there would have been an extra 330 deaths, which would have meant 355 in total. But to look at life years lost, which is a better measure, it would have meant that across the board at birth, there would have been loss of 26 days, or approximately 1 month. And his calculation also found that the lockdown meant that there was a 1 year loss of life. So by taking the approach of being freer, we would have lost 12 times less life years lost. So both equations, although the one in our paper is considerably higher, the calculation by Dr. John Gibson, University of Waikato, also shows that lockdowns are not as advantageous as it would have been if we had have kept our economy and our society going. When we look at the World Health Organization's position on the virus, vaccines and lockdowns, there was a number of quotes that we gathered from two key figures from the World Health Organization. One was Dr. David Nabarro, who is on the WHO envoy, special envoy on COVID-19, and also the Director General, Dr. Tedros Ghebreyesus. And some of those quotes are there. You know, we must learn to live with this virus. No country can just ride this out until we have a vaccine. Even if we do have a vaccine, it won't end the pandemic on its own. Lockdowns are not a long-term solution for any country. We do not need to choose between lives and livelihoods or between health and the economy. That's a false choice. The pandemic is a reminder that health and the economy are inseparable. Please stop using lockdowns as your primary control method of the coronavirus. And finally, lockdowns just have one consequence that you must never ever belittle, and that is making poor people an awful lot poorer. So you know, our position around lockdowns, and here in New Zealand, lockdowns are a means to achieve elimination. We're reaffirmed by what we've seen coming from representatives from the WHO. So, you know, there's been a great talk by Byron Bridle around vaccines, and you know, some of our concerns around the vaccine that I think you know, he's also covered is how this vaccine has been rushed until, I think this is the fastest ever developed vaccine. Until the record for vaccine was 4 years, and so this took place within a year, and so corners must have been cut. There's been little data on the efficacy and safety of these vaccines. In the UK, we know for the Pfizer vaccine, there's legal protection for Pfizer with regards to that vaccine. We don't know how the vaccine handles antibody-induced enhancement. And also too, we're not sure on how these vaccines may react with new strains of the virus. And when we look at vaccines and eradication or elimination of viruses and diseases around the world, you know that smallpox is the only disease that's been eradicated globally with an effective vaccine, and that took 35 years. And in Africa recently, wild poliovirus has recently been eliminated from that country, and that took 30 years, but other strains of poliovirus still remain. So we know it takes a heck of a long time. So if we think we're going to wait for elimination in New Zealand before we open, we could be waiting a mighty long time. Also, too, we know that many people will refuse to be vaccinated. There was a study in the UK, and I think about 20% of those surveyed said they would not be vaccinated. And I think here in New Zealand, there's a recent study where 1 in 4 or 25% of people said they wouldn't be vaccinated. So waiting for a vaccine in order to achieve elimination, there's other issues that are involved there as well. And then Simon earlier talked about the experience of swine flu, and the same things we're concerned could happen here with COVID-19. And so with the swine flu, when it was found that it was extensively throughout a lot of populations, people didn't really want to, there was no real need for the vaccine, but also too, the vaccine caused some adverse reactions, and one of those was narcolepsy. And I think those who took the swine flu vaccine compared to those who did not were 5 times more likely to develop narcolepsy. And so this is when you're not, when you're rushing things and you're not looking at the safety profile of them, these are some of the things that can happen. And this led to many vaccines throughout Europe. I've got a few slides here of vaccines, the number of vaccines that were destroyed in Germany and the Netherlands, but also in the US. In excess of $1 billion worth of vaccine were destroyed because there was no use for them, and also they were dangerous. So these are some of the concerns that we have around the way that this vaccine's been developed. But listening to Byron Bridle's presentation, it goes into that a heck of a lot more. And already, there's been a few issues here with some of the vaccines for COVID-19. Early on, there's a few NHS workers who had strong allergic reactions to COVID-19 vaccine that they had, the Pfizer one, I believe. And so there was a warning there on people who had allergies to not take it. In Norway, there's an investigation into 29 deaths. I think the majority of those were in frail elderly who are most at risk of negative implications from COVID-19 anyway. And if it's not protecting frail elderly people who are most at risk, then how useful is it? And then probably most recently is the point around South Africa ceasing the rollout of the AstraZeneca vaccine because it doesn't seem to be effective against this strain. So some of these concerns that we initially had are kind of playing out a little bit, but it's still quite early in the piece. So it'll be interesting to continue to monitor how the vaccine is handled by other countries. So this brings me to kind of an assessment of where do I think the government sit with regards to the elimination strategy and using lockdowns to achieve it. And there's a few pieces that have recently come in the media that kind of allude to why I'm thinking the government have moved in their position. And so firstly, this piece was published in the Guardian, in the UK Guardian a while ago, and it's our Director General Ashley Bloomfield, and the headline there is "COVID unlikely to die out," says New Zealand Health Chief Ashley Bloomfield. And when we look at the text, COVID-19 is unlikely to ever die out, even with vaccination efforts, but it could become more transmissible and less deadly. New Zealand's Director General of Health has warned. So I think here he is acknowledging that we're not going to eliminate it in New Zealand. It's unlikely to die out, and I don't know. I don't know if it's becoming less deadly because the virus will change, but it's just possibly our tolerance to it, like we've talked about around. Byron said he'd rather get the virus to have that immunity than be vaccinated on a more specific part of the virus. He goes on to say that if you think about influenza, which was first recorded in 1172, I think, in Europe, these viruses don't tend to die out. They change over time. And in fact, what we are seeing with these new variants with the COVID-19 virus is that they tend to become more transmissible and less deadly over time. So I think here we've seen our Director General of Health acknowledging that elimination is unachievable. So I think, straight away, I see that the government and the Ministry of Health is moving away from the elimination strategy. And then our Prime Minister, Jacinda Ardern, at their first, I think, caucus meeting year, also addressed the issues of the vaccine and COVID-19. And she said that the government's goal is getting COVID to a point where it will be managed like common seasonal flu. And so this is a real, I think, change. There's a significant change in the way the government and the media report and can speak to the issue now. It's not as catastrophizing. A lot of time it used to be this deadly virus, and a lot of the time my colleagues and I have been taken to task for comparing this virus to seasonal flu, and now we see our Director General of Health, Dr. Ashley Bloomfield, and our Prime Minister comparing it to seasonal flu. And I'll just play you a snippet now of Jacinda speaking to the topic at this meeting, which was in January.
Our goal has to be, though, to get the management of COVID-19 to a similar place as we do seasonally with the flu. It won't be a disease that we will see simply disappear after one round of vaccine across our population. But our goal has to be to put it in a place where, as we do every year with a flu vaccination program, that we roll out a vaccine program and maintain a level of normality in between time. That has to be the goal that we're striving for.
So again, this just it shows how the way COVID-19 is being reported and being treated by our politicians and then in turn the media is quite different from last year, and which is, I think, a good thing. And I do believe that the government, they don't want to go into lockdowns. I think maybe they have seen the negative impacts and they've heard those, and I do believe also that they have walked away from the elimination strategy because those pieces say that to me. Also, too, we had recent case of a few community transmissions here in Auckland, and there was 3 in total, but when I read the article, it sounds like there was 4. But, our second lockdown in Auckland, we locked down Auckland for 3 weeks because of 4 cases. And here we've had 3, and there was a very low level of hype and concern about it in terms of the way I felt it came across the media and reporting them through the government. So again, this kind of just says to me that that the approach has moved away from the elimination strategy, and it's more about learning to live with the virus, and that lockdowns are not one of the ways that the virus needs to be handled or wants to be handled by the authorities now. So considering that, I thought, well, what could send New Zealand back into lockdown or us into lockdown here? And there's a few things that I think could, and the first of those is if there was a significant number of community cases and community transmission cases, and if they were publicised well. And so I think that's the first thing. It took 4 cases in Auckland for us to trigger a citywide lockdown. And I think a similar thing, if something happened, then that could start the process of us going into lockdown again. Although I still believe that it's not the line that is wanted to be taken now. The second thing that I think would promote that is if there was a publicised call for lockdown from acknowledged experts. And so we have a number of experts who are quite supportive and think that lockdowns are one of the best tools that we have to deal with containing this virus, as well as wearing masks and things like that. And so I think if there was cases, and then if this was in turn promoted strongly by these, particularly these academics and experts who have the ear of the government and also the media, then I think that would also play a major factor into pushing us into a lockdown again. And then finally, if there was a public outcry to lockdown because of the 2 previous things, then I think there would be a change into lockdown. And I think, over the course of last year, the way COVID was handled here, I think there was a lot of fear generated and a lot of anxiety being generated too in the New Zealand public. And so if there was an instance where it was publicly seen to be irresponsible to not move to locking down because it's not protecting, then I think that would be another factor that the government would consider that may in turn move to creating us, sending us into lockdown again. So those are those things, and I suppose some of the thoughts. But I do believe things are changing, and I think I think that our letter has helped that, as well as all the other things we do. But I suppose in conclusion, I suppose a significant change I think hasn't occurred in the tone to which the government and media address and possibly perceive the threat of COVID-19 in New Zealand, and continued open dialogue and reporting on issues related to COVID-19 from both perspectives is vital for both a balanced understanding and response to COVID-19. Thank you.
Right. Thanks very much, Gerhard. We're over time, but can I just ask quickly, do you think, how does the government, and particularly its supporters, these academics you showed, and people in the media, have all been running the narrative that was lockdown what won it for us, despite the fact that lockdowns everywhere else seem to have continued and not worked? But that's the narrative. How would that change, or do you think that's also part of the thing that would lead us into a lockdown again, or perhaps even resist it? Because if it worked, if it had worked back then, why would we be doing it again? Any comments about that?
Yeah, I think there's always political spin, and I think I think for a lot of people who may not take as deep a following, then that's the solution that understand is that the lockdown is why we're here we are. I think as information is continue to be shared, and I think getting our messages out as much as possible, I think helps inform the public better. So
cool. Thanks, Gerhard. Thanks a lot. Gerhard was also responsible for perhaps the best 3-minute spiel on I think it was News Talk Radio that captured the imagination of a lot of people who are listening. In 3 minutes, he sort of summed up every argument against lockdown, every argument against COVID being the threat that it was meant to be. It was a piece of genius. So thanks, Gerhard. And Anish, you're with us?